Okay, welcome to this talk on persistent pain and eggshells. I'm happy to have you here, Liz.
Thank you. Happy to be here.
Okay, walking on eggshells implies an image of being overly careful when stepping on a bunch of eggshells, trying to make sure that they don't break. I need to be really careful, people think. You can appreciate that?
Yeah, been there.
Okay, therefore, walking on eggshells is a metaphor used when describing the emotions felt by a person living with or working with someone that gets angry at the slightest provocation. Or when people say, hope I don't make them angry.
Yeah, you're on edge.
Exactly. Many people living with persistent pain have a sense that they're always walking on eggshells. But instead of being fearful of a person, they are fearful of their pain becoming angry with the slightest provocation. Does that resonate a bell with you?
Yeah, scared to take risks.
So thinking that if I'm careful, I won't have as much pain.
Caution, yeah.
You may consciously or subconsciously be frequently checking on your body to see if you're okay, worried if you're going to worsen your pain, even with the smallest of activities or movements. It's like when people say, I don't want to hurt myself anymore, or I should definitely avoid doing that. The problem with the perception of walking on eggshells is that it also implies that you're made of eggshells and potentially quite fragile. Now, be honest with you, do you feel that you're fragile?
Sometimes I do think I'm fragile. I should limit myself from doing things.
And so there's this quote, if I'm careful, I won't break. I'm going to have as much pain.
Yes, if I don't push myself too far, then I won't get worse.
Exactly. Do you find yourself asking questions such as, did I do too much? Should I have done that? Did I damage anything? Did I sit for too long? Will I feel worse tomorrow?
Yes, absolutely.
It's time that you stop walking on eggshells and stop feeling as if you're fragile like an eggshell, because it's simply not true, right? The fact is that we're all naturally wired to associate physical pain with physical damage. And we all have experiences where physical injury has resulted in pain at some point in our lives. Does that make sense?
Yep.
Okay. However, the assumption that all pain must therefore be associated with a physical injury is quite inaccurate, as one can experience pain and suffer without any evidence of an injury or tissue damage. What do you think of that?
I think that's quite interesting.
You know, what frequently people say, I have pain, yet doctors can't find anything.
Yeah, they don't know what the culprit is.
But the idea that the cause of a person's pain may have little to do with an injured body part is often not acceptable, and some find the suggestion of it to be highly offensive, thinking, what a bunch of nonsense. My pain is real.
Yeah, we're looking for the physical sign, the culprit of what causes the pain, right?
And if anyone insinuates that there's nothing actually injured in your body, would you take it personally?
Yeah, it's not validating.
Yeah, and I want to make sure that you're validated, because here's the fact, all pain is real. There is no such thing as imagined pain. If you experience it, it's real. Mm-hmm. Are we clear on that?
Yes, my pain is real.
The last thing I want anyone to even possibly imagine is that somebody's insinuated that their pain is not real or valid, because it is real. What we're saying is pain is not always from an injured body part. That's all. But the nervous system can cause pain on its own. Even if they eventually accept that an old injury isn't the cause of their symptoms for the past number of months or years, many simply find something else to blame, such as their poor posture, bad alignment, or weakness, thinking, I'm falling apart.
Yeah, put the blame on myself.
And we want to move away from that because it's not conducive to recovery, especially when it's not true.
Yeah.
For a number of reasons, people with persistent pain continue to walk on eggshells and perceive as they're made of eggshells. And sadly, they naturally avoid many of their desired activities for months or even years.
I've done that.
Have you found you've avoided certain activities that you really used to enjoy?
Yeah, things I really used to like, I just don't do anymore.
To make matters worse, they then believe that because they have been inactive, their pain must now be because they're out of shape and that their muscles are tight or weak, which further justifies the fear of movement and activity, further adding to the pain experience. Where they say, I can't do anything anymore, so what's the point?
Yeah, I limit myself.
I just want to feel better and get my life back. What am I supposed to do? Do you find there's so many options out there?
Yeah, I just don't know where to start.
And I'm sure you've tried many of them already.
Yeah, don't know which ones to do next.
And they haven't worked for you so far.
Not in the ways that I need.
Okay. If you're dealing with persistent pain that hasn't yet responded to various therapies and medical treatments, you may consider a new approach to dealing with your pain. You know, doctors do their best, but sometimes they say, I don't know what else to do about the pain. And inevitably the person worries, will I ever be okay? Welcome to the Persistent Pain Clinic. You can see there's 3 options for a lineup. The first lineup is medications, injection surgery, where there's a lot of people lined up. Second lineup is manual therapies, needling, and machines. And there's popular also. And the third lineup that's not so popular is the concept of understanding pain first, mindset shift, and lifestyle changes. And people aren't keen on lining up. What do you think of that, Liz, this little comic strip?
I think because it takes a lot of hard work, and we don't think it's going to yield the results that we're looking for. We think that the medications or the other therapies are going to do what they need, and sometimes they do its job for a little, but we need more. I need more. I need something else.
Yeah, you nailed it. And people think the other treatments are going to be a quick fix. Mm-hmm. But in fact, when you're having persistent pain, nothing is a quick fix. You know that already. So why do you think there is no lineup in front of that still?
I think that it has to do with accountability. I think lifestyle changes require ourselves to look at ourselves and our lives and decide which things need to change and which mindsets are really contributing to keeping our pain persistent and contributing to a lifestyle that allows our pain to take over and limit us.
So how do you think we can make that third lineup more attractive to people? The concept of if they understood pain, feared it less, mindset shift, where they didn't have to fight so hard with their pain.
I think that if that person wasn't behind a glass and they were standing out there telling people that all 3 options are available to them, but have they heard of this one? Have they ever thought of this? What would be easy or hard about trying new lifestyle changes? Talk to them, someone who is talking to them one-to-one. I think that would help people in finding out about this new method.
Great points. It's time you stop walking on eggshells and falsely believe that you're fragile as an eggshell, because it's simply not true. To determine if the Pain Truth program is right for you, simply answer the 6 questions on the homepage of thepaintruth.org.
All right, I'll start there then.
Thank you, Liz, for being here.
You're welcome.